I'm Peter Block in Chicago at ACC 2016 for On the Scene. And with me is Phil Schauer from Cleveland. And he's been involved in a really important trial, one of the most important trials to come out of this meeting. I'm not going to spend a lot of time on introduction. Phil, tell me about the trial and what you did.
Sure, Peter. Yeah, this was the STAMPEDE trial. This is a randomized controlled trial comparing two types of bariatric surgery, gastric bypass, sleeve gastrectomy, with intense medical therapy for treating type 2 diabetes. So we enrolled 150 patients and randomized them to these three arms. And at this meeting, we're presenting our 5-year results.
So now that you've done the surgery, you've got a long-term outcome, and the results are really pretty striking.
Yeah, so the primary endpoint was the success rate at reaching a fairly aggressive A1C target of 6% or less. Now mind you, at the baseline, it was 9%, so these patients were in poor control. So patients in the medical therapy group, only 5% met that target, whereas almost 30% met that target with gastric bypass and about 23% with the sleeve gastrectomy.
So two different ways of getting to the bariatric surgery, two different techniques, right?
Right.
And also I think, as I remember this trial and the data, these were pretty high-risk patients, obese patients with very high hemoglobin A1Cs.
Right, the average BMI was 36, the A1C was 9%. They were on 3 diabetic drugs at the start of the trial. They were in fairly poor control. So surgery put them into very good control. The average drop in A1C after surgery was close to 3 percentage points. So they went from 9% close to 6%. And with this 5-year study, we showed that it was quite durable. In fact, at 5 years, that therapeutic gap seems to widen between the surgical and the medical arms.
One last question, then, that is, as I looked at these data, some patients were quote-unquote cured of their diabetes.
Yes, about almost 30% of patients who had the gastric bypass, for example, reached a 6% or less without medication, so reached what we call long-term remission, which is pretty remarkable.
Okay, Phil, very exciting data, 5 years out now for bariatric surgery. Tell me what this, the nuts and bolts, what does this mean clinically?
Well, Peter, I think this is a really good news for cardiologists. They now have a new tool. Obesity and type 2 diabetes are the major drivers for cardiovascular disease at current time, and medical treatment is not always effective. So we now have a surgical option that's relatively safe. And I forgot to mention there was no mortality, no surgical mortality in this study, and very few surgical complications. So it's a safe approach and very, very effective at not only reducing type 2 diabetes, but also many cardiovascular risk factors such as improving HDL cholesterol, reducing triglycerides, and also reducing medication burden, both diabetic medications as well as cardiovascular drugs.
I don't know, Phil, you're starting to sound like a cardiologist to me, but this is an exciting trial and gives us all a new tool for treating high-risk diabetic patients. Thank you.
Right, thank you.